group of scientists advising the Health Ministry on COVID-19 projections has predicted that more than 40,000 South Africans could die from the coronavirus by November. The presentation was made on Tuesday by a consortium of COVID-19 modelers, editors and journalists. It suggests that 1 million people could be infected and that we may not have enough intensive care unit beds when the pandemic peaks. There are currently 4,000 ICU beds across the country. The projections indicate that we will need between 25,000 and 40,000 ICU beds by September. To discuss this further, we're joined by Milan, the editor of the Bhekisisa Centre for Health Journalism. Mia, good afternoon, good evening to you. What does this modelling actually tell us that we need to prepare for about the number of cases and, unfortunately, possibly the number of people who will lose their lives?
Well, we've certainly prepared, in terms of hospital capacity, we've certainly prepared more beds than they would have had without a 5-week lockdown. But regardless of whether the country follows the best case or the worst case scenarios that the modelers have come up with, one thing is sure. We are going to run out of intensive care beds, like most countries have. You've mentioned now that South Africa has about 4,000 intensive care units in the public and private sector combined. About 2/3 of those beds are in the private sector. And we could need up to 10 times that number, modelers have found. And that means that according to the modelers, our ICU beds could be overwhelmed as soon as early June. And this is particularly likely in the Western Cape. And once this happens, patients in need of ICU beds will have to be accommodated in other wards, and health workers will then have to make very tough decisions about who gets to have an ICU bed that helps them to survive, or a ventilator, and who does not. And they will be getting a list of criteria that they have to follow to make choices like that. Now, in terms of how will we get more beds, or how will the government get more beds, they have been in talks with the private sector to ask if they can have beds for patients that don't have medical aids that would require beds. But the details about what the private sector is expected to charge the government for that has not been made public. Though some hospital groups, for instance in KwaZulu-Natal, have pledged to donate beds for free.
Mia, can we tell at this stage how accurate these projections are? I mean, these are quite scary projections, frankly. I mean, they're put together by some of the best brains in the business, obviously. Can we tell at this stage how accurate they are?
Well, mathematical models have limitations. In this case, how people behave, so for instance, how much social distancing South Africans will practice and how often they will wash their hands, will influence the outcome of the projections. So modeling projections are tools that can help you to think about the future so that you can plan, but they don't necessarily tell you precisely the future. And because of this, South Africa is planning to update its projections weekly.
It's very, very sobering. Do you think just these numbers, just these predictions being made public might actually change people's behaviour? It shows you how serious this is.
Yes, absolutely. It really depends on how South Africans behave, and that's why we have worst case and best case scenarios, because it all depends on how much we slow down the spread of infections is directly related to how we behave.
It's Milan there, of course, from the Bhekisisa Centre for Health Journalism.